Good morning. My name is Richard Cho, and I serve as Senior Advisor for Housing and Services to Secretary Marcia Fudge at the Department of Housing and Urban Development. I want to thank the Oregon Housing Conference for inviting me to speak about the work of HUD and the Biden administration in addressing homelessness, including among people struggling with addiction issues. My role at HUD is to advise the Secretary on HUD's policies and strategies for addressing homelessness and for how we can better meet the housing needs of other vulnerable populations, including people with disabilities, people who are in institutional settings, older adults, and people impacted by the criminal justice system. As my title indicates, a starting point for how we think about how to meet these needs is to link housing with supportive services and healthcare. So much of my role actually involves thinking about how HUD can coordinate and align our programs to work better with healthcare and supportive services programs, ranging from Medicaid to the Substance Abuse and Mental Health Services Administration's behavioral health programs, to community health centers, and many more, so that we can provide a package of housing plus services. And the Secretary actually asked for my position to exist because she understands that housing is essential to solving homelessness. We know that access to safe, stable, and affordable housing is what solves homelessness. There's no question and debate about that fact. But housing is essential, not because it's the only thing that people need, but because it's what makes meeting all the other needs that people have possible. Housing is more than four walls and a roof. It is what people need to hold a steady job, to help children succeed in schools, to build community and social connections, and to attain better health. Housing should be the envelope through which we deliver services. I think we learned that really clearly in the COVID-19 pandemic, when our nation and our planet, frankly, was faced with a pandemic emergency. One of the very first things that we were told was to stay home. Our homes became the first line of defense, the first form of personal protective equipment, if you will, against a deadly infectious disease. Our homes became where we worked, where our children went to school, and even where we saw doctors and therapists. But what if you didn't have a home? Or what if substituted for a home for you was a congregate facility or an institution where physical distancing was impossible? So we know that whether during a pandemic emergency or not having a home is a life and death matter. Homelessness threatens life, but housing is health. I'm really proud to work for a president and a secretary who recognize this. And it's because they recognize this that in his very first legislative achievement, President Biden's American Rescue Plan included historic housing assistance resources to address homelessness. $10 billion in funds, including $5 billion to fund 70,000 emergency housing vouchers, a new housing voucher program specifically intended to meet the needs of people who are experiencing or at risk of homelessness, including over 1,500 vouchers in Oregon. This was the very first ever housing voucher program specifically focused on addressing homelessness, other than for veterans, and it required public housing agencies to partner with homelessness continuums of care to ensure that the vouchers were reaching households who had the highest needs. And it's been a huge success. It's ramped up faster than any other voucher program we've ever implemented. And it's already assisted over 65,000 households who are experiencing or at risk of homelessness. We also provided $5 billion in a special allocation of home funds that were intended to assist people experiencing or at risk of homelessness, including to create new permanent supportive housing and other deeply affordable housing. We provided $67 million to the state of Oregon. And grantee communities are projecting that they'll use those funds to create over 20,000 new units of housing to address homelessness, as well as assist another 23,000 households through tenant-based rental assistance or supportive services. Now, where I come from, $10 billion is a pretty strong statement of belief that housing can solve homelessness, and that housing, especially for some of the most vulnerable, needs to be part of a pandemic response and recovery package. But of course, we also know that homelessness was getting worse even before the pandemic. And so HUD and the administration's actions to address homelessness didn't stop just with a pandemic response. We also launched House America, a national initiative where we engaged mayors, county leaders, and governors to take advantage of these historic resources that we provided to solve homelessness, not by displacing people or clearing encampments, but by connecting people to housing and building more housing. And over a 15-month period, leaders from 105 communities joined, and they collectively helped to rehouse over 100,000 households and add more than 40,000 new units of housing into the development process. The state of Oregon contributes to this House America goal, and rehoused over 4,000 households and added 200 new units of housing to the pipeline. HUD, working closely with Department of Veteran Affairs, we revived a joint interagency effort to end veteran homelessness, and we made it a top agency priority. Over the last 2.5 years, we've awarded 6,000 additional HUD VA supportive housing or HUD VASH vouchers. We stepped up efforts to connect veterans to housing using HUD VASH and other programs. VA launched a national challenge to house 38,000 homeless veterans during 2022, and they achieved that goal, and they set another goal for 2023, and they're on track to meet that goal again. We adopted a new federal strategic plan to prevent and end homelessness called All In which we set a goal to reduce homelessness by 25% by 2025. And we also worked with administration partners to launch All Inside, an initiative that will help 7 communities with some of the highest rates of unsheltered homelessness to solve unsheltered homelessness by embedding federal staff person and taking advantage of all of the resources and flexibilities that the federal government provides. HUD also issued and awarded the first ever package of resources, $486 million in grants and over 3,300 vouchers to help communities specifically address unsheltered homelessness and rural homelessness, including 2 grants in the state of Oregon. We created a new disaster response fund called RUSH to ensure that people who are already experiencing homelessness when a natural disaster strikes were provided with long-term assistance to find housing even after FEMA assistance ends. Just a few months ago, we also released the largest ever annual continuum of care notice of funding opportunity, making $3.1 billion available. And in the coming weeks, we'll award another 4,000 additional housing choice vouchers, which actually for the first time will provide incentives to public housing agencies to serve households experiencing homelessness. Over the last 2.5 years, I would say that HUD has done more and provided more resources to address homelessness than we ever have in many decades. In the same period, we've also issued more housing vouchers across all of our programs, 120,000 vouchers that have been, and that's more vouchers than we provided in nearly 20 years. I mean, that's a lot of resources, but is it enough? I would say no, it's not enough. We're facing a homelessness crisis and a housing crisis, the likes of which we haven't seen in this country since the Great Depression, maybe even worse than during the Great Depression. And we all know that the work to solve homelessness has only gotten harder. We're seeing a shortage of rental housing and rising rental costs, along with eviction rates that are returning to pre-pandemic levels. And that's leading to the displacement of millions of Americans every year. In fact, from 2021 to 2022, we saw the number of people who experience homelessness for the first time grow by 26% in that single year. That's another 180,000 households who became homeless for the first time during 2022 compared with the prior year. We're seeing a brutal rental housing market that's now also making it harder to rehouse people who've become homeless. And we're also hearing from communities about severe staffing shortages in frontline staff workers that's making it harder to connect people to housing and supportive services. And we're also facing a public that's growing more impatient and less compassionate, with growing calls to resort to policies and practice that we know are inhumane, coercive, ineffective, expensive, and which may even violate people's civil rights. So it's true that we are facing greater headwinds in this work. Now, I'm a cyclist. I know cycling is big in Oregon, but you know, when you face stronger headwinds as a cyclist, you don't stop pedaling or slow down. You actually pedal harder, you dig deep, and you focus on what works to make you move faster. You tighten your form, you focus on pedaling more efficiency. And that's what the Biden administration is doing. We're certainly not backing down or slowing down in the face of growing challenges. We're digging deep and we're doubling down. We're doubling down on what works. Because in spite of the challenges we face in solving homelessness, we have one thing that works for us that few other vexing social problems have. We actually know what works. We know that housing works to solve homelessness. We know that supportive housing can solve homelessness for some of the people with the most complex needs. We've proven that through study after study. We know that assertive community treatment plus housing works for people with some of the most acute serious mental illnesses. We know that rental assistance works to solve homelessness among families with children and improves their outcomes in almost every domain, from health to education to preventing family separations. We know that stable housing supports successful reentry from prisons and jails, prevents post-incarceration homelessness, and can also break the cycle of incarceration and homelessness for people who are caught on that cycle. We also know that housing can help people recover from addiction and also can support recovery. And I'll say this really clearly, housing is essential to recovery. And that's what we mean by housing first. Not that it's housing only, or that housing is all that people need, but that housing is the starting point and the foundation for successful recovery. Now, I know there's people out there who challenge that idea and will claim that housing first doesn't work for people with addiction issues. So let me ask this. So for people who have a stable home and have addiction challenges, has anyone ever heard of a treatment model in which we take away people's homes and tell them they can only earn it back once they've demonstrated enough abstinence? No. We know that having a safe and stable home and a supportive community is what enables people to participate in treatment in the first place, and then to continue to achieve and maintain their recovery. So I say housing first is about recovery. It's simply the idea that people should not have to worry about being homeless while also trying to recover, but instead they can have a stable home, supports, and a community in which they can be supported in their recovery. But to make housing first effective, that also requires that we provide people with supportive services. So in my final remarks, I just want to let me share with you some of what HUD has been doing in partnership with the Department of Health and Human Services to ensure that we are putting the support that makes housing truly supportive. In December 2021, HUD and HHS, we signed a joint memorandum of understanding that established a new technical assistance center called the Housing and Services Resource Center. It serves as a one-stop shopping center to obtain information on how to coordinate HUD programs and HHS programs so that we can connect housing and services to address homelessness and assist people with disabilities. HUD has also been working closely with the Center for Medicare and Medicaid Services to really ensure that states know that they can cover a range of housing-related wraparound supportive services under their Medicaid programs. CMS has developed a housing as a health-related social needs framework that clarifies how states can cover those services under their Medicaid programs. That includes things like tenancy-sustaining services, pre-tenancy supports that help people prepare for, find, and obtain housing, and even to cover things like housing application fees and moving expenses, security deposits, and even up to 6 months of rent and utility assistance. Several states have already received approval from CMS to cover these housing-related services under their Medicaid programs through 1115 demonstration waivers, including in the state of Oregon. And I'm very excited to hear more about how Oregon is going to implement their housing-related services under their 1115 waiver. In the coming weeks, HUD and HHS are going to announce a new technical assistance offering for states that have approved 1115 waivers that cover these housing-related services to really accelerate their implementation and so that these states can learn from one another. So Oregon and Arizona and Massachusetts and California and many other states can actually learn from one another about what it takes to ensure that Medicaid is funding those wraparound supports and are coordinated with housing vouchers, homeless programs, and other housing resources. HUD's also working closely with SAMHSA, who is dedicating technical assistance resources to help the grantees who received our funds to address unsheltered and rural homelessness, to leverage all of the behavioral health partnerships and resources that are available. And we're also working to encourage the growing number of certified community behavioral health centers that will soon be expanded through the Bipartisan Safer Communities Act to provide behavioral health services that can help people transition from homelessness to housing. And we're also working closely with the Health Resources Services Administration to ensure that community health centers and rural health clinics are providing healthcare and wraparound supports to transition people from homelessness to housing. All of this work is grounded on our belief that homelessness in America should not exist, and our belief that homelessness is solvable, and that even in these challenging times, we can make progress. I remain as hopeful as ever in this work. Why? Because I believe in housing. I believe that we know what works. I believe that we actually have many of the tools and strategies that we need to solve homelessness. I also believe because I've seen firsthand people's lives transform through the power of a stable home. I believe because I've seen the data and evidence that shows that housing is effective and less costly than to let homelessness persist. And I believe because I believe in all of you, the people who do this work every day to assist people to find and obtain a home. Those of you who work every day to house our vulnerable neighbors, you are our nation's greatest heroes. You are what makes America great. After all, we are a nation whose identity is rooted in the experience of displaced people finding their way home. A nation that's far from perfect, but ever striving to right its wrongs. And then with every person that you all help to house, You helped to right decades and centuries of wrong. I want to thank you for what you do.